Hi, Bill Lanting from Allergy and Asthma Center of the Rockies. As dentists, you're seeing a lot of people have allergies, horrible allergies. The biggest thing you're probably seeing is allergic rhinitis. When you're doing procedures and you work it on the mouth and you have them breathe through the nose, they don't have a nose, or you can just hear all the congestion and stuff going in. I mean, I just fitted for a crown again, and they put that blue gunk in here, you know, that to get the form, and you have to breathe through your nose. And I asked my dad, I said, how do people do this that have horrible rhinitis? And he just looked at me. It's like, because, you know, they just don't have a nose to breathe through, or it's very congested. So allergic rhinitis is a very popular thing. If you think about it, 1/3 of the world is allergic or atopic. That's 1 out of 3 people. So out of this United States with 313 million people, that's 100 million people. And very few of them are actually treated or treated well, or they're taking over-the-counter stuff and it doesn't work, or it doesn't work that well, or they got side effects like drowsiness and sedation. And they don't even know it. They have these horrible symptoms. Their life is not what it should be. And they just go on because they don't know that this could be allergies and things can be done for it. Whereas you know, gee, you know, the lady's got horrible allergies. Why don't they do something about it? Because again, people just don't realize it. Or it's genetic most of the time. So it's the family curse. Mom had it, their uncle had it, their grandmother, and so they go, I'm supposed to be like this. So, you know, why should I even think about doing something about it? This is the way it's supposed to be. The answer for all this is no. They could be living a wonderful, symptom-free life if they just realized that this was allergies. So how do they present? Well, yeah, they could have itchy, red eyes, but the nose, stuffiness, congestion, bad enough that they mouth breathe. Besides that, they can have a lot of blowing, you know, mucus and sneezing, or many of them have postnasal drip, where it's going down the back of their throat. They have cough, throat clearing, sore throat, nausea from all the mucus they've swallowed, you know. And you guys see this because when you look at the back of the throat, they usually have cobblestoning. You know, it should be smooth like glass. They have all this bumpiness back there. It can also lead to headaches in the facial region, or even migraines. Or it can also lead to chronic sinusitis because the ostia, you know, the tubes that drain the nose are chronically pressed on by this inflamed, swollen tissue, and they have, again, air getting caught up there or mucus getting caught up there. A lot of these people also have asthma because if you have congestion here, it goes down the tube and can have congestion here because this is one airway. If you take a proper breath, air goes down like this. So sometimes there's problems here and here. And again, people live with these nasal problems and all these side symptoms, but also breathing issues. In fact, a lot of them also have other comorbid conditions like migraines and reflux. All this is tied in to allergies, and they just don't know that they could live a wonderful life and do something about it. And that's where you come in. You see these people, and you just know that they're living a substandard life. It makes your job harder because they have all this congestion and mucus and stuff, but they could be living a great life. So if you're not sure, you can ask them some simple questions. Do you have itchy red eyes? Do you have a stuffy or congested nose? Do you have a runny nose? Do you blow a lot? Do you have drip down the back? Do you have cough, throat clearing, sore throat? Do you have any nausea and stuff like that? Or do you have any problems breathing? And if the answer is yes, then you say, oh, these could be allergies. You should see your friendly neighborhood allergist. And that's why I would hope that you pick up on this and send them so we can live a wonderful, symptom-free life with them. That's the great thing, is that they will thrive and do well because you picked it up, you recognized it, you changed their life. And that's what's really good too, because then they'll sit there and go, wow, I had all these symptoms, and my dentist realized that I had allergies and all my problems and all this I don't have to live with. Now I feel great. Thank goodness for he's not only, or she's great at working on my teeth or my dental presentations, but they made my allergies feel great. Oh, I love them. Not only do you have a happy patient, remember, happy patients refer. And, you know, patient referrals are probably the biggest source of our new patient base. So again, allergies, allergic rhinitis, very common, but something that we can do something about to make them feel fantastic once we figure out it is allergies, what they are, and what we can do about them. And again, you're the front line. You're seeing them. You're the ones that know something's going on. So please refer to Allergy and Asthma Center of the Rockies. I'm Bill Lanting, and I should also mention that we have a wonderful website, aaacor.com. aaacor.com, where we have a lot of informational videos on allergies, allergic rhinitis, asthma, different allergic presentations, so that if they're not sure, patients can go to this website and figure, oh, maybe something's going on, this is me. One other thing I should mention is that a lot of patients have different anesthetic or cane allergies, and we're good about diagnosing those too, to know which particular anesthetic people are allergic to, which ones they're not, so that you can perform procedures in a safe manner and not have to worry about patients anaphylaxing on you. So again, I'm Bill Lanting, Allergy, Asthma Center of the Rockies. Thank you for watching.